the April Behavioral Health Advisory Board meeting for Deschutes County to order today. Thank everyone for coming and being here and adjusting to that schedule change to Zoom. Much appreciated. At this time, if we can go around and move to introductions, I'll just go down the little participants list I see here. Dana. You're there?
Were you talking to me?
Oh, yeah, just doing the introductions. I'm just going down the
Oh,
list I see.
sorry, I was working on
That's
some
okay.
YouTube stuff in the background. Dana Murray, I'm the Deschutes County Behavioral Health Administrative Assistant.
Thank you. Julie?
Hi, Julie McFarland, small business owner and part of the NAMI Board of Directors.
Julie, Captain Schultz.
Yeah, thanks, Lee. Captain Michael Schultz with the Deschutes County Sheriff's Office.
Thank you, sir. And Danielle.
Now McBain, board member, parent of a kiddo who accesses services. I also work at Mosaic Community Health.
Awesome. Evan.
Evan Namkung, Program Manager, Forensic and Acute Services with Deschutes County Behavioral Health.
Thank you, sir. Amber.
Hi there. Good afternoon, everybody. Amber Clegg. I'm a clinical program manager here at Deschutes County, and I help oversee our access and access team in a lot of different projects.
Awesome. Thank you. Holly.
Hi, Holly Harris, Behavioral Health Director. Good to see you.
Thanks, Holly. Kristen.
Hi, Kristen Misaki, a Program Manager. I oversee the adult outpatient teams in Bend and our two hubs in Redmond and La Pine.
Awesome. Thank you. Linda.
Linda, you're muted. There you go.
Do it? Okay. Yes, Linda Nolte, adult foster home provider for IDD, home and mental health combined. And I've been doing it about 13 years. And I'm new, so I'm learning a lot.
Thank you. Lindsay.
Hi, everybody. Lindsay Hoffman. Hi, Lee. Nice surprise to see you.
Yeah.
I am a clinical supervisor with Intensive Youth Services, and I am covering for Shannon Brister today. So that is who I am today.
So, thank you. Mary.
Good afternoon, everyone. My name is Mary Burns. I'm a behavioral health program manager with the Central Oregon Health Council.
You. Nicole.
Hi, everyone. I'm Nicole Von Leben. I'm the Program Manager over Deschutes County Behavioral Health Crisis Program.
Thank you. Paul, you're next up.
Hey, everybody. Paul Partridge, Program Manager for the Intellectual Developmental Disabilities Program at Deschutes.
Thank you, sir. Stephanie.
Hi, everybody. Stephanie Etzman, board member and parent of an adult child who accesses services.
Thank you. And last I see Commissioner DeBone. If you...
Hello, Tony DeBone here. I just happened to make my way over to the Courtney building, so now I'm in the conference room all by myself, but I was able to figure out how to get online. If anybody's in the building, I'll come join you in your office.
Well, thank you for being there. Again, my name's Lee, co-chair, work at Redmond Treatment Center up in Bend. And thank you, everybody. Is there anyone I missed who popped in? Okay, awesome. Well, for the next few minutes, we have this space for any feedback for Commissioner DeBone or the county, just on your experience with Deschutes County behavioral health services in whatever capacity, a constructive or positive thing. If you can raise your hand with the little icon just so we can pick the right person on Zoom, this is the space for a few minutes to share that.
I've got one item.
Sure, go ahead.
So Paul, you're just reminding me that you were at the Oregon Prepared Conference. We had a presentation there, and sorry I missed it, but I saw a whole list of Deschutes County employees and folks from Deschutes County presenting. It was a conference in Sun River, Oregon Prepared under the Department of Oregon Emergency Management, and really just kind of coordinating amongst different agencies and leadership and resources for if there's a natural disaster or any disaster incident, how we can all work together and make some relationships. So as I say, sorry I missed that presentation, but I think there was a whole bunch of Deschutes County folks involved.
There were, Commissioner. Lee, if I may, a moment, I'd like to give folks a briefing on what that was.
Sure.
Yeah, a fantastic example of partnership that I have endeavored toward in other counties that I've served in Oregon, and not had the level of success that we have here in Deschutes. This was partnership. I'm sure I'm going to leave somebody out, but partnership among my office, IDD, information technology, and the sheriff's office, namely emergency management. We've been able to develop a protocol in which we can stand up a call center to contact the most vulnerable citizens throughout Deschutes County who are either signed up, they either are enrolled through our program, and we have a special protocol that allows us to share records with the sheriff's office when people are in immediate harm's way, like a fire evac. It also includes folks that are signed up through Deschutes Alerts. So we have actually deployed that call center a few times last year during fire season, and it was very successful. We just had a training on it earlier this week, and then we presented it at the statewide conference. So we were very proud of the partnership cross agency within Deschutes County and throughout our community, really. Thanks for bringing that up, Commissioner.
Awesome. Thank you guys. That's the kind of stuff that we love to see. And I'm glad to hear. Anyone else?
One quick thing, Lee, and this is not related to what you're talking about right now, but I just wanted to let Commissioner DeBone know that the room has actually been booked all day for WIC program. They have something going on there, so they might be coming into that room at some point. They're probably at lunch. Dana's looking to find you an office that you can use upstairs. So just hang tight and we'll get you all settled.
Thanks, Holly.
Well, yeah, no problem. As I say, I'm just on my phone in here and it's working well.
Okay. Thanks.
It's important stuff. And awesome. Cool. We're at that point where hopefully everyone got Dana's emails and has been able to look at last month's minutes for March. And I'd like to see if we have a motion to approve last month's minutes.
I'll make a motion to approve last month's minutes.
Thank you. Do we have a second?
I'll second that.
Thank you, Captain Schultz. All in favor, please say aye or raise your hands. Okay, awesome. Any opposed? All right. Thank you, everybody. Next, we're going to move into the chair, co-chair follow-up report of a couple pieces that were from last month and a couple new things. Following up from our conversations, and this will be more addressed in Holly's report from that conversation on the Oregon rule related to how we can support drug use tracking or delegation as a board to meet this requirement is what that conversation is, and she'll discuss more of that. My research kind of confirmed that there are a couple agencies outside of us that do this. Pacific Source has one with a lot of providers there, but whether or not they are the right people to do this or not is a thing for us to discuss and have Holly's input later on. So this may be something we continue to table for, do we take action? Do we move forward? So that'll be followed up there. And the next thing was following the trend that Melinda and I have set of, we're going to get Holly's input, we're going to get the commissioner's input, but where do we want to go this year? And what do we want to do as a board is kind of our theme. And now that we've got our training wheels on and our helmet on for this process, we really want to look at getting everyone's input for what are like our top few priorities, like 2 or 3 things that we could target some action for, whether they're more letters of support, whether they're finding folks to come in and give reports from the county, whatever it is that helps everybody on the board feel like we're doing something that also sticks with our values as board members on the board. Some of the ideas that are floated, just things from last year, access to care, helping support the cost bill, supporting stabilization center funding, creating various sort of things that fit those needs, how we can advocate, were just thoughts there. But what would be the best way you guys think for problem solving this? Should this be more of like a full meeting that we kind of throw it on the wall and chunk it down, or send out like a survey monkey, everybody provides their top 3? Like, how can we help get everybody's input on what these 3 priorities are, or whatever they may be?
Lee, I think a survey would be great, at least to whittle it down to maybe everyone's top 3, and then we can kind of compare those. It seems like a better way to start, and then maybe a meeting where we discuss how to whittle it down further. I think it just might be too big and too vague if we throw it into a meeting now.
Fair.
I totally was going to say the same thing, but also I don't know how exactly the Survey Monkey format is, but maybe have however many ideas that you want, but a space or 2 for people to fill something in, because we might be forgetting something, would be really helpful. And then, have a follow-up conversation maybe at the next meeting or whatever.
Yeah.
But I think that would be a great place to start.
Awesome. Thank you.
I agree with the first 2 ideas, and would want the first effort at gathering our ideas to be pretty much open-ended, because there may be some idea out of left field that only one person thinks of, but it resonates for all of us. So to have that as open-ended as possible, I think.
I'm obviously new here, so please take this with a grain of input or an offering from a person who's never been to a meeting. But I'm from the Central Oregon Health Council, and one of the main things that we do is conduct the Regional Health Improvement Plan, which the latest edition, which will run from 2025 through 2029, was just published. And the community, through the regional health assessment, did identify very specific priorities for them on topics of mental health and alcohol, tobacco, and other substances. So that might be a good resource if you are looking for them to guide choosing priorities in terms of the goals that the community has written for themselves.
So that's a really good place to look. Thank you for that, Mary.
Mary, is that somewhere where you can direct us so we can just go click on the tab or whatever, the link and find it, and then we can all look at that in our own time, and then that might spur some ideas for each of us?
Absolutely. I just dropped a link in the chat, and also it lives on the Central Oregon Health Data website. So it is at this point not the most intuitive thing to navigate. So I'll also put my email in there. And if questions come up or you have any follow-up and want to talk about it, you can always reach out to me.
Thank you.
Okay. Awesome. Sounds like moving forward, Lynn and I can look at, so also feel free, it's the 18th. So if you guys could maybe if you could email either Melinda, myself, or Dana, whichever of those you have as a point person, any specifics you would like to add like on there that we could put into that survey for you guys and still have that open-ended one. If there's a strong passion project, we'll get that survey created, and if you do that by April 30th, then we can have that out for May, and you guys can get on there, whatever that survey looks like. And then we'll come back with these are the top 3 or what have you, and kind of go from there. Holly.
Yeah, I just wanted to offer if it would be helpful or not. I mean, sometimes the regional health assessments can be a high level. And if you wanted the managers or our group to kind of spend a little time on this topic in one of our meetings and provide some kind of more granular, like specific gaps or needs within the community mental health program here locally, we could also offer up some suggestions that you could throw into the survey if that would be helpful.
Yeah, or even later in terms of how to address those ideas and priorities we've found.
Yeah,
that would help too. Thank you.
Okay.
All right, so our next item here is a vote to delegate authority to the advocacy chair to sign letters of support. And so this intention would allow Danielle on the letters of support committee to sign it once we have it templated and looked at, so we can take some extra steps out of the process to smoothly move it along in terms of approvals and signings. And it doesn't, not everything needs everyone's signature is the intention of that. And yeah, and that is the hope. It's to make sure when we write these letters that we can smooth it out. Yeah, Robert's rules, I think I can motion to move, put a motion
Hey,
in.
Lee, can I ask a question first?
Yeah.
I was under, after our last meeting, I was under the impression that Melinda was signing them as the chair. I hadn't heard that we'd kind of changed ideas. So I'm just curious about that. And because I know we did one letter, I never saw if it was signed and sent. I drafted it and sent it to Dana and Melinda, but I don't know what happened after that. So
I believe it was signed and sent. Is that correct, Dana or Holly?
I'm not sure. I did send that on to Melinda on the letterhead. And I'm not sure where it went from there.
Yeah, I think that was my understanding was Melinda was going to take care of it. And I think the topic that we talked about was to bring it back here to see whether or not you all wanted the chair to be the one to sign it or whether it would be more efficient to have it be somewhere else.
That's correct. Thanks, Holly.
Yeah, there you go. And Melinda's input is that she's, from our conversations, that she's okay with that option if that's what you felt is best.
So was there a motion on it to either have Danielle do it or?
Not yet, but that's what would be up is to have motion to have Danielle be able to sign them and move them along, or still have Melinda do that.
Just for a discussion, I think great, Danielle. Thank you for doing that. That's what she wants to do. and it streamlines the system because we're all talking about it. So, and I'm ready to make a motion if there's no further discussion, right?
I'm just curious because I've never seen it not come from a chair or vice chair for the most part. So is this just the idea that it just is one less step? Like if I'm going to write them, that it can get signed and get in without having to go through multiple emails to get signed? Is that what we're thinking?
Yeah, that was the intention of the change.
I have a question for Holly, since Holly, you deal with this kind of thing probably more than anyone else, maybe. What have you seen? I mean, are we putting ourselves in a lesser position if a board member signs, or is it the assumption is if the board member has signed it, the entire board agrees? I mean,
Yeah, I think these types of letters, it's all about volume and kind of the agency from which they're from. I don't think any one of the legislators looking to see whether the chair, vice chair, or committee member signed them. So I think from their perspective, and from my perspective, it doesn't matter. It's really as long as we have it in a motion or outlined in our notes that the authority has been given to the chair to do that on behalf of the board. I think it's totally fine. It will have the same impact.
thank you. Well, I'll make a motion that we delegate authority to Danielle if she's willing to do it and do the signatures to speed things along.
I will second that motion to the wonderful Danielle. Thank you.
Thank y'all. All in favor, say aye or raise your hand.
Aye.
Thank you. Any no's? Okay, passes. Nice. And thank you guys for walking through my first little chair.
Just
I was
say
nervous.
there may be occasions where I have to recuse myself. It's unlikely, but I also input a lot of stuff to the legislature. So in my work. So if there's any conflicts, I'll just let you all know and we can still do it as a group, just maybe having Melinda sign or Lee in place of me.
Awesome. Thank you. Well now, thank you guys for that. We'll move over to the director's report with Holly.
Great. Got a couple updates and then I'll end with our local alcohol and drug planning committee conversation that's related to the statutes that we discussed prior. But just a couple quick updates around our residential capacity. Our IDD mental health co-occurring home is officially purchased. So that is great news. That's our 5-bed group home that will be going. Our RFP is closed for the provider. So we are rocking and rolling. Paul has just led that effort and done a phenomenal job and got great community support from the community of Redmond and the surrounding neighbors for that home and did a lot of outreach. And so it's been a really good process. And we are close to getting a provider selected, but then we have a lot of work to do to remodel the home and get it ready for occupancy. Paul, anything you want to add?
Oh, just the selection process for providers is down to a grouping of 5 or 6 that we have invited for interviews the last week of April, the first week of May. A couple of different mornings we'll be interviewing the 5 or 6 finalists for that.
Very exciting. We got lots of applications. So Paul did a great job of doing outreach to a large swath of providers across the state, and it worked. He's had his hands full sifting through all of those applications. So good stuff there. Our secure residential treatment facility, just keeping you updated. It still looks like right now it's still on schedule for construction, set to open in July of 2026. And then on Monday, Evan and I are going to the board to request approval to explore another property and for a mental health adult foster home. So we are, if all those things keep moving, we're in good shape by next year to have some real added capacity for our community, which is all great stuff. Still working on our child psych facility. Don't have necessarily any new update. We've just got we've got legislative requests for both the federal government, state government. We've got requests out to OHA. All of them are looking really promising. It's just kind of a matter of seeing which ones fall, where they're going to, and what amount of money may or may not come to us. We'll have to just kind of watch that process. But we've sought funding from everywhere we could. So we just have to see what happens with that. Sorry, somebody was about to ask a question, I think. No? Okay. So that's residential. Legislative updates, workforce bill and our cost study bill. Those are the two big ones that we're monitoring. They have both moved to Ways and Means. So there's a lot of bills that are sitting over in Ways and Means, and there'll be kind of a big push from all over the state for everybody's projects to see what gets funded out of there. So we'll just kind of be monitoring that. I'm sure there'll be opportunities for people to weigh in, but we'll have to watch and see how that goes at this point. A lot of other bills died because they didn't make it that far. So down to the wire here. A civil commitment bill that's going through. It looks like it's getting some traction, but unfortunately, there was a hope that it was going to kind of lessen the bar, the standard for which it takes to get someone civilly committed. It doesn't look like it's kind of going in that direction. It's definitely hoping to broaden the criteria around dangerousness, but it's the way it's worded now, I'm a little worried that it's not going to make any major meaningful improvements to the civil commitment statutes as it's written now, but we'll see how that plays out in the legislature. Any movement in that direction is a good thing. So even if it doesn't make anything major this go around, if we get a step in that direction, it'll be a promising thing. So keep more to come on that one. The director recruitment posts, I think, this weekend for Janice's position. They have asked me to be interim starting in mid-May through probably September-ish while we look for the director, knowing that there's not going to be an ability for that person to overlap with Janice as she is retiring May 30th. So we will be in a situation where I'll be acting as Janice. So we're going to have to do a little bit of maneuvering in behavioral health to make sure I get the support that I need so I can do that job. And this stuff keeps moving forward. So thankfully, Amber Clegg and Shannon Brister have both offered to step up and support me through that time period while we still recruit for our new director. So we'll share more about what that means for this group and sort of the structural things that may need to shift during that short time period, but I'll keep you guys posted. I'll still be heavily involved in behavioral health, but just may need some help with the logistics.
Thank you very much for that. Yeah, this is Commissioner Devon. I'm mobile now, so just letting you know. But yeah, thank you very much. It'll be a time of transition. We'll get through the budget together and the leadership of the health department during this retirement.
Yes, thank you, Commissioner. Appreciate the support. Also, our budget presentation is happening May 14th. So it's a public meeting, as you all know, so feel free to tune in if that is of interest to you. I think we don't have a huge, they've really tried to condense it, I think, into less days this year, so it should be a bit more efficient, and we have a little less time to go through our presentation, but we're a pretty well-oiled machine at this point on that front. So we will be doing that then. We're really hoping to have the analysis of potential Medicaid impacts and cuts that may impact us. Just sort of like if there's a 20% Medicaid cut, this is what that means for behavioral health. If there's 50%, if there's no cut, just sort of some scenarios. Obviously, they're what if scenarios at this point. We have no idea what's going to happen, but we want to be prepared and have at least a sense of if they do happen, what does that mean for our fiscal outlook in behavioral health? So that hopefully will be part of our presentation in May. So those are my big updates. Anything else you want me to touch on before I jump into this local alcohol and drug planning committee conversation?
Just what time is the budget presentation meeting?
Yes, let me just grab that for you real quick. It's sometimes a little bit like kind of depending on how long the other ones go, but it looks like we're scheduled in the morning. So I'm assuming we're probably going to be one of the first ones that day. 8:40 to 10:40 is what I have on my calendar. So feel free to tune in live to that. I think we have, I don't think we have any new budget committee members this year. Correct me if I'm wrong, Commissioner, but I think it's the same one. So that doesn't mean, that means we don't have to necessarily go back and explain everything that behavioral health is and does. It's, we're kind of able to hit the ground running a little bit. Okay.
Yeah, we've got the same members for a couple of years now, same members for a couple of years, and we're doing it in 3 days, so it'll be kind of 9 to 5 for 3 full days, so that the health department will be when she mentioned. And we'll be working together well. Obviously, the budget path is dynamic and narrower right now are the two statements I would use. We just, challenging times, but Deschutes County is in a real positive situation relative to some other counties, which is, not good that others are struggling, but we're not struggling as much as others by far. So that's the big picture.
That's great. Thank you, Commissioner. Good way to describe it. Dynamic and narrow. All right, local alcohol and drug planning committee. So this topic, just as a reminder, came up as part. I'm in the middle of contract negotiations with the state for our county financial assistance agreements. Those are the agreements that basically fund behavioral health. And so we're negotiating it, we're changing things up, but one of the things that came up is this ORS actually, around local planning committees. It has been required for behavioral health for some time, but they're kind of doubling down on what that needs to look like going forward. I think historically, we didn't really, I don't think anybody was really auditing for it. They weren't really looking for it. And I think it's one of those things that just wasn't on the radar. And I think we also thought this committee already met that requirement, but now it's really called out in a very separate way. So basically what it says, and I'm just going to read high level a couple of things around what this statute requires. It says the governing body of each county or combination of counties in mental health administrative area as designated by the Alcohol and Drug Policy Commission shall appoint a local planning committee for alcohol and drug prevention and treatment services, or designate an already existing body to act as the local planning committee for alcohol and drug prevention and treatment services. It says it shall coordinate with the local behavioral health resource network, so that's the BERN, described in ORS, whatever, to identify the needs and establish priorities for alcohol and drug prevention and treatment services that best suit the needs and values of the community, and shall report its findings to the Oregon Health Authority. And so one of the questions that I think some places do is they just use their behavioral health advisory boards and designate them also as this committee. And it just, that way you're kind of working in a co-occurring space and dealing with both substance use and mental health as part of the work that we do here. But Lee there's also some other groups in the community that do specific work around drug and alcohol, collaboration planning, all of those types of things. So I'll let Lee talk about those if you would like. I wish Callie were here because she leads a group that one of the ones that Lee knows about. And we were wondering if that might be an avenue or whether we wanted to think about having a liaison, having us be the designee, but have a liaison to those groups. So there's lots of different ways in which we can do this, and we don't have to decide today. So it's just really a topic of conversation, and we can do more research if needed. We're not, this is not an urgent on fire thing.
Yeah, thanks, Holly. So I know that I don't know the specifics because I don't work for an agency that is in the BERN system, but they do have regular meetings and requirements for what they do. And they do some surveillance and some things in their world. But what Callie Rumley, who sometimes is here on Zoom, and Pacific Source has, they have what's called a SUD forum related to the providers they work with that cover substance use disorder, for those who don't know the acronym, versus behavioral health and so on. The pseudo boxes of separation that aren't really there in how they format things. But this is a once a month meeting with at least 15 to 20 providers. The county, I believe, has someone that shows up. My company, our program director comes to that. Best Care has representatives, New Priorities, various folks show to that once a month, and they have various conversations, presentations, things like that. And again, table for later because Callie's not here, but that's the one I know that is the most all-encompassing across private, public sectors and multiple service providers. They even include some veteran-specific folks, so things like that, who may show up. But that's the one I know of that would be that do we delegate them? But I don't know, given potential dynamics of who and why that meeting exists, if that's even something they want to do or would fit our needs. So that would need a little bit more research and outreach potentially.
I can speak to that meeting. That was a meeting that, in partnership with Pacific Source, that we actually convened. Asked Pacific Source to facilitate it, to keep it, I don't know, on that side of things. It's a very well-attended meeting. The primary purpose of it is to bring the providers together to share resources, to work on building a stronger collaborative infrastructure within our community. And so it's been going on for a little over a year. And I think this is something that we could bring to the leadership of that meeting and talk about. We do a lot of education, a lot of relationship building. We have speakers that come in. So we've learned a lot about the different resources within the state and in the community. So this might be a natural progression potentially for this group to take on this. So I think it would be a great conversation to have. I'm happy to reach out to Callie, or I don't know, help facilitate that in any way I can.
That would be
Thank
great.
you, Kristen.
My 2 cents worth on that is it feels like our group here has a lot to do, and we're trying to be very focused on behavioral health, and things are starting to really ramp up, and we're starting to really do things. And this is probably the wrong term, but it would feel like our committee was diluted if we had to pivot and talk specifically about the alcohol side, when I can attest, I don't know that side as well. So I'd be learning, and, would I be able to put as much attention and knowledge towards it? It doesn't feel like, if there's another option, it doesn't feel like we are the right ones to do that. That's my personal opinion.
Julie, I was thinking the same thing. You and I got our brains meld together. I would say I'm not opposed to it, but I would say those of us that are here with personal experience came in on the behavioral health and IDD, not, not all of us with personal experience with SUD. Not that it's unfamiliar, and not that it's not of interest and important, but I don't know that I would bring the knowledge that I have, with the other. So I would say, yeah, if there's an organization, a group that already does it, why reinvent the wheel? And also, yeah, we feel like we're just finally, I think we're getting a good path going, and to veer and add, I think might challenge us a little bit, and maybe not a positive way, but I'm not 100% opposed. I think there are better options, I guess.
This is Commissioner DeBone. One thought is the terminology. Behavioral health is mental health plus addictions, and that just pops into my mind when we say those words. So, I'm not asking for anybody to work outside their comfort zone, but just understanding what the terminology as I understand it is. Behavioral health is mental health, and or addictions.
Yeah, that's a great point. I mean, I think that's the pro, right? That's the pro of it being with this group, is that it would actually sort of align the behavioral health work, kind of, address some of the addictions needs as well, because, many of the people we serve in behavioral health also have a co-occurring substance use disorder. The large majority of them do. So we've often, and Lee can speak to this as well, it's just these feel like two separate systems. And they're really not. But I also do think there's some more targeted work happening in other areas that may have more bandwidth to dive into. I think it would behoove us to think about a connection point. If it is outside of this group, how we might have that sort of come back through this group, so that we're not just focused on mental health, and we are thinking about co-occurring disorders as well, and at least aligning any activities you all are doing in that space as well. So just something to think about.
Yeah, the system is perfectly designed to get the perfect results. And for too long in the way it's gone, national and trickle down, who's responsible for the substance use? Where's it come? Who's going to really truly own it and work with it? Hasn't truly, I think, effectively been answered over time to the systems that we have, where it's confusing. Like, who really is doing this? Is it behavioral health? Is it public health? Because public health is doing an overdose outreach and helping with this or that. Isn't that it? I mean, yeah, but if you go to a psych ward, people get kicked out of the psych ward or out of the ER, and their suicidality is undervalued sometimes or mistaken at times in high stress situations because they popped from methamphetamine or they have other situations. So and depending on the research you talk to, 50 to 90% of the people in a given residential outpatient setting where the primary diagnosis, aka why we're asking someone for money, is mental health, has SUD2 or has SUD and a mental health with it. So they are interrelated. And it would be a negligence if we didn't have a pulse on it and an understanding. Because it is in the behavioral health world, however awkward it is, and how related they are. People want to treat their mental health. They can't do certain things. History of meth use, people are not getting, or even though there's data that says people with history of meth use can be successful with medication management, doctors don't give it to them, even though it's years since they did anything. That type of stigma, that type of stuff exists across the board, and they're going there for mental health, and the impact is there. And when we talk about access to care, I would say that it's good to keep the pulse on it and some of those things without being overly soapboxy. It's important for us, and I think that we shouldn't overly lift and do too much because we are recalibrating our focus and our attention. And I agree with what Julie and Danielle are saying in terms of our load moving forward. But we definitely should look at something and liaison, and not to say, Julie, you're the outreach person, go outreach there. No. It doesn't have to be like that. But some sort of pulse connection, build relationships, something where there's a director report. Maybe if we get a relationship going with Callie, she gives a check-in or something from that meeting so we know what's up. Like, it can be simple, it can be bigger, whatever we feel, but it
I have a thought on
I think it's there. Yeah, go ahead.
It would be really easy, it seems like to me, to add into our agenda and carve out 5 minutes. And when Kristen or whomever approaches the other committee and says, this is what we're trying to do, and is this something your drug committee, substance abuse committee can take on? But with that, our committee would like to know more about what you guys are talking about and what you're doing. So we would like to send a representative from our committee to your monthly meeting. It might not be the same person every single month, but that person from BHAB will be there, and then they'll come back and they will share the information with their committee. And if they want to do the same thing, they're invited to come to our meeting, and they can do whatever they want with the information. I have to believe, when I kind of try to step back about this committee and who we are today and where we have come from 2 years ago, there's a lot of information being covered. It's very specific. We've learned to, address the important things and get them out there. And if I were someone coming from outside and coming in and taking good notes, I'd be like, wow, I learned a ton about behavioral health and what's out there in a short period of time. I think one of us, and again, I could do that, go to the other meeting, get the information, and try to come back and relay it in 5 minutes at the agenda. I don't think that would be too hard to do. It's not like sitting in the meeting for an hour and a half every month. So we're not going to get that kind of information, but we're going to get the basics and the hot topics and that kind of thing to bring back. Just an idea.
So this is Linda. I agree from what I'm hearing that the worlds are a lot more interconnected than maybe we've looked at it. And would it be appropriate for whoever is the chair of their committee to participate in these meetings so that we're not only learning more about that world, but they're learning more about the resources in this world? It just seems to me that if somebody's having a mental health issue and they can't or won't or don't know how to get resources, it's very tempting to want to tune out through substance abuse or alcohol and not get appropriate behavioral health treatment up front that would actually help them live a productive life instead of moving into the addictive world. So I really get the synergy and would support some kind of ongoing sharing of information, whatever that would look like.
I'm sorry I'm talking so much. I definitely have opinions on this. One, I wouldn't necessarily want to throw it into the chairperson's plate, who's already taken on a lot, and say all of a sudden you have another meeting to go to every single month. I think that would be easily shared by people who are willing to go, and just a rotation. It certainly wouldn't be, there's 16 of us here. So that means once a year you go to a meeting and you report back. That seems to me like that would be easy. Secondly, kind of like where Danielle and, we seem like we have similar stories. My lived experience with a family member, and unfortunately, was all mental health and very little substance abuse. Thank goodness, knock on wood. I believe, yes, they're intertwined, but I believe they're two very different things. Also, there are experts in each field, and I have to believe that other committee is really drilling down on alcohol and substance abuse, and there's more talk about drug use and those kinds of things. And I'm not saying they're not interrelated. I'm just saying it seems like let the experts in their fields focus on the areas that they know the most about.
I may have misspoken. My thought was someone from their committee would sit in on our meetings, not necessarily. And that's a mechanical thing. But my thought was they would come and share with us and also learn from us rather than us going to their meeting. Who goes to what meeting is really not my thought so much as just they learn, we learn. But if they had a few minutes, just like we do here on the agenda, what do they want to bring to us for us to understand in the context of behavioral health decisions? So maybe I misspoke, and I apologize if I did.
I also just want to mention Danielle has had her hand up, and then after her, Kristen.
Thank you. So as we've been talking about this, and it's a great conversation, I think my thinking has morphed a little bit because I do have a kiddo who has co-occurring behavioral health, both mental health and IDD. So I do get that. And, at Mosaic, we do a lot of work with SUD. And so I do see how it would fit in here. And as we were talking, I was really thinking, what if we kind of goes with what Julie and Linda were saying, but slightly differently. We've been talking about new board members. Couldn't we ask someone from one of these groups that are already focused? I mean, we have Lee, obviously, and others who have experience. There are plenty of people in this group that don't have IDD experience. And the broad range of mental health, like what my son experienced is vastly different than what Roger's stepson experienced. And so I think that there's room for that in the learning. And I think inviting someone else with that knowledge and background to be on our board would be a fantastic idea.
I just wanted to say that if it makes sense for the SUD forum with Pacific Source to be designated for this, that both Callie and I attend this meeting and that meeting. And so we could be the liaisons or work with anyone else who's interested in doing that. But we do attend those meetings. Callie is one of the people who organizes the agendas. And Deschutes County has quite a presence there, but there's a few of us that go consistently. So I think as far as information sharing, that would be an easy thing for us to do if we end up going in this direction.
I think that's one thing I want to do too, is I'm going to reach out to our public health partners and just make sure that there's not something I'm not aware of in terms of the work they're doing that aligned with this ORS, and that, that I just want to double check all of that. That step I skipped. I should have done that before this meeting, but I've already sent them an email. But if they are not, I think that idea of having a board member specifically from that committee, and then you would almost have enough for a little mini subcommittee between Callie, Kristen, and that board member. If there were strategies that you all identify as you go through this exercise that are related to substance use or co-occurring disorders that committee could work on, that would be really, I think, really meaningful.
I really appreciate where this is going. Thanks, everyone. And yeah, I hear a lot of really good ideas. I know Dana's got notes. I've got notes around what sounds like moving to some sort of communication and integration, whether we liaison, whether we target a board member, or carve out 5 minutes, and Kristen, who attends there, can let us know what's up. That we have a lot of good ideas. Is this something we want to, again, it's not urgent, high priority today. Is this something we want to make a decision on today, or do we want to kind of see if we can check in with Callie and we kind of report back and see how this keeps evolving next month?
So I could make a motion that we explore the practicality of having a board member with that specific connection and body of knowledge on our board, that we explore the practicality of it. I'm not proposing that we decide today that we have a board member, but see what would be the pros and the cons and what might be the benefit to both.
I was just going to say that I think that not having Melinda here is a big thing. Since she's the chair, it would feel strange to kind of make movement on it without her, in my opinion. And then also, if we waited till maybe next month, Lee, you would have an opportunity or someone to reach out. I think you said Callie, to have some of those discussions, and maybe her or some of those people, some of those folks could come to the next meeting, and then we could get more information. I don't know.
And I could also do my due diligence and make sure that, public health isn't doing something along these lines. Kristen could reach out to the group and just, maybe even float this idea of, because like one thing I don't know is even if there's some other designated committee, we're so big now. I don't know. We don't always know who's doing what. And so there may be some committee that I'm not aware of that is already designated as this. So we could do a little due diligence. I think, if it had been appointed by the county, Commissioner DeBone would likely be aware of it. So I think we can go back, do some more research, bring that information back to the next meeting, if that works for all of you as well.
Yeah, that works for me. Let's bring it back is my thought.
Okay, I didn't hear a second to your motion. Linda, does that work with you we're going to go do our various forms of research and have a more updated conversation that can hopefully meet those pros and cons kind of conversations you were looking for?
That was what I was suggesting. It doesn't have to be a
Okay.
motion, but that was my suggestion. Yeah.
Awesome. Cool. Yeah. Well, then we will check back in on that next month with our and report back on what we found and how to move forward. Did you have anything else on your report, Holly, besides this? Okay.
That's all I have.
Awesome. Moving to subcommittee excuse me, our membership crew is not here today, but from last month's meetings and check-ins with Cameron through this, the steps have been put in place and they have officially stated Molly is in a place to be recommended for membership to the board. And at this time, if there is a motion to fully recommend her candidacy to the Board of Commissioners, we can vote on that today for Molly.
Lee, this is Stephanie. I am actually on the membership committee.
Oh, sorry,
I wasn't
Stephanie,
able,
apologize.
that's okay. I wasn't able to make it to, and I don't think Cameron was at last month's meeting either. So since I'm here, I'm happy to make that motion
Right.
to
Go ahead. Thank you.
yeah, have Molly join our board as a board member.
I ask a question? I'm sorry, I'm full of questions. I apologize, but I thought we talked about this last month, and maybe I'm misremembering, but that we were gonna see like something about Molly, because I think most of us, some people know her and some people don't, and it feels strange to vote on someone joining the board without knowing. So I was just wondering if we could get something before we vote on it. Is that a possibility?
Was there was what was discussed, since I wasn't at last meeting and I know Cameron wasn't either, I think, and then so I don't know that whatever that was decided was relayed. So what was discussed? Do you want to invite Molly to come to a meeting and introduce herself?
Well, either that or like we talked about, like a one-page resume of who they, who she is, or I think the application has changed, so I don't know if the application was appropriate, but I thought we discussed something like that. You guys tell me if I'm misremembering, but I thought we had that discussion, and then that once we had that, we would vote on it, because we heard that you had Stephanie and Cameron, I think, had interviewed her, met with her, and all was good.
So I'll add my 2 cents worth. I feel the same way. I've never even heard of her. And she might be fabulous, but I don't have a way of knowing that. And I would like to have a one-page summary or something that isn't too burdensome, to know, what kind of skills and information and what niche, if you will, that person might fill that would round us out. I'd like to know that before voting.
Yeah, that's great. I know that at the time that we had interviewed her, she had not completed an application. She was not asked to complete an application. And I think that there was some confusion and miscommunications because of the turnover and the formation of the committee and the turnover in the chair and co-chair, vice chair. And so we did ask her to go ahead and complete an application. I'm going to go through my email and see. I know we ran that up the flagpole, and then we got an application that was suitable for her to complete, and that was forwarded on to her by Cameron. And I am just checking to see if she completed that and sent it back. And it's been a couple of weeks since I've seen any emails. So just bear with me. I'm doing a quick search.
I do have her application.
Oh, perfect.
She was able to fill it out and get it back to us. And she was originally going to attend this meeting, but was and then after that, she's out of state right now, so she wasn't able to attend today. So but I think Holly said she would be happy to give us an overview of experience and qualifications. Holly, do you want to take it from there?
Yeah, I'm happy to if that's helpful. Again, staying neutral on whether you all choose to vote her in or not, but I have worked with her for many years, as have many other managers on this call. She actually worked here at the county many years ago, probably close to 20, right, Amber? I'm looking at you because you were probably here at that time.
Over 20 years ago, yeah.
And she worked on CSS at that time?
She was crisis and CSS,
Yes.
and worked downtown.
Yes, she did that work here at the county. That was years and years ago. And then she moved over to the hospital, and she was really instrumental in the development of Sageview, and was the manager and then director over Sageview for probably 10 or 15 years. And then came back to the county for a brief stint during COVID, and oversaw our adult intensive services for a period of time. And then now is the director of behavioral health, one of two directors of behavioral health at St. Charles Hospital, overseeing all things behavioral health within the St. Charles Hospital system. So she's a licensed clinical social worker by trade. She is very knowledgeable of hospital systems, especially, but also pretty knowledgeable of community mental health and IDD and how the systems interface. And so that's kind of what I can tell you about her. She's well respected across the community. And heavily involved in our law enforcement work as well, with CIT and other things that we're involved in. So if that's helpful.
It is helpful. Thank you.
And yes, apologies for the awkwardness with this. Molly has been discussed since sometime last fall, I believe, in various ways, and she came on when that very large government website application process went away and it changed. And due to all of that, and this is one of those things in the handoff from old leadership that has been a bit jumbled, that we're looking at. And I know Cameron and Stephanie, everybody, were trying to get something from her. I'm not, and Dana has the application. The last email that I see from Cameron earlier today, when she couldn't make the meeting, did say that Molly Wells Darling is recommended. And that we, given everything in her process, because she, I think, may have even started the government application and then had to change it up because of what she did this originally to join us, with Roger's help and assistance at the time, that we were not necessarily fast tracking any vote, but wanted to make sure we did vote for her as soon as that application came in or whatever was there. Is sort of where we are and how we got here overall, just so everybody knows.
I think the question though, Danielle and a few others, is, do we need to vote today? My thought is we don't need to vote today. She was supposed to be here. It sounds like she's not here. I think we put it off for another month and see if she comes. I really like Molly. I've worked with her. I've worked with her husband. You can Google her and see some of the stuff. But once she gets here, I think it'll ease the mind. I think it's important we see somebody come in, and I'm sure, one of the things is, do you have the time to do it? It'd be nice to hear from her to do that, because we've been waiting. We haven't seen her yet. Let's get her here. I don't know. Should I make a motion or should we just leave it at that?
I think we can leave it at that. That we would like to see her be present when we vote for her.
And who would give her that assignment? I talked to her. Holly probably talks to her way more than I do, and a few others. But if somebody wants to call her, I don't mind doing it. If somebody else knows her better than I do. I see her husband. He was law enforcement more than her. So, but I think we should assign somebody to reach out to her.
I believe, in Stephanie, you would know this with Cameron and Peter, but primarily the last couple months, our point of contact has been, I think, through our onboarding group and potentially interactions with Dana in terms of who feels best to reach out.
Yeah, I think, well, with working through the application process and making sure that she received the correct application to complete and return, that point of contact has been Cameron as the chair of the membership committee. I think that, I can send an email out to Cameron and Dr. Bohm and just let them know that what we talked about at today's meeting, and a request or an invitation to attend our next meeting is what we would like to extend that to her, and see if Cameron wants to do that, or if it's okay if I just send her an email. So, but we can take care of that.
Awesome. Thank you.
Mm-hmm.
You're muted, Lee.
Thanks. Julie, any updates on community outreach?
So, no, I don't have any updates. What I was hoping is not to create extra work for everybody, but maybe this will take less than a minute, is in the next 2 weeks, you've got my email. I'm trying to figure out who this committee is, what we really do. I don't think we have a real defined who we are. You know, there's been talk about going out into the community, finding a place to go, like the lighthouse or whatever, and doing a quick tour so you can see what's out there and available, and learn about resources in the community. And that's done on your own time. I think a lot of people in this group probably know about most of those kinds of things. So it's almost like it would be not a waste of their time, but I want to do something that's interesting to everybody. The other side of it is, would outreach be better having somebody come in like we used to do, telling them they have a time limit, every other month, and having somebody come in and for 10 minutes tell us who you are, who you serve, and what you're doing. And maybe it's some of the smaller groups out there that we don't all know about that are out there providing something, and they'd love to come and share who they are, and this is where we're located, and that kind of thing. I guess I'd like to get a sense from everybody. I'll just kind of pool the information. Do you have a preference of one over the other? After, not after work, but at the end of the day, going out someplace and doing a 20-minute tour. That's asking a lot when the committee, everybody's limited on time. Or would people like to have somebody come in and talk for 10 minutes every other month about who they are? Once I hear from everyone, then next month, I'd like to say this is kind of the results, and it sounds like the group would rather do this. And then based on that, I might pick one or two organizations, and we'll either set something up like we did last month with the Lighthouse, or I'll ask to see if we can have somebody come in and talk about who they are. But I wouldn't probably do that every month. I'd probably do that every other month, because we seem to have a lot to cover these days. So if you want to just send me an email with your thoughts, I'd love it. And then I'll report back next month. Is that okay?
So I have a question. This is Linda. And it probably sounds really stupid, but I'm going to ask it anyway. What is the end result that we're looking for from outreach activities? My head is thinking of several things, but I wasn't real clear. Are we doing outreach to understand the other resources so we can be more aware of who to refer people to? And or are we doing outreach so that people who are in need of services can find us and be led to the right resources? And I don't know what the third and or would be. So we're doing outreach. What do we expect to happen as a result of the outreach? What need are we trying to fill, and for whom is my question.
And that's what I'm trying to drill down on. I think it
Okay.
can be anything that this group wants it to be. So that's why I'd kind of like to hear from everybody. What would you, we're the ones putting in the time on this committee. What would you think is the best use of this board's time? Is it learning more about the resources? Is it getting our group out there into the community? I'm not sure at this point that if somebody had a crisis, Linda, they're gonna pick up the phone and call BHAB and say, hey, BHAB board, direct me. I don't get the sense that that is our purpose. If everybody wants that, I guess it could be, but I don't get the sense that that's what our outreach is about. But it could be a lot of different things, and I want it to be a meaningful committee. And if we don't think we need it, then I'm not a fan of committees that aren't necessary. We've got a lot to cover, or maybe there's another committee that would be more useful. But if people have a strong sense of what they want this to be, we can make it be whatever we want it to be, is kind of my sense. Unless Commissioner DeBonne has a different sense of what he thinks the outreach should be or what it's been in the past.
So
Yeah, you ready?
Julie,
Ready for a thought? Ready for a thought from Commissioner?
Yes.
Kind of big picture stuff. The 1960s deinstitutional efforts, the fact that we're trying to manage some very complicated cases in our community. Maybe we need to really advocate for more resources to get the right services to the right people. I've always thought that, yeah, we're doing this effort, and the intention at the federal level and the state level is to probably do it right, but it's always underfunded. So then, it kind of puts you in the spot of our secure residential treatment facilities and how we're getting there. And I'm just going down one path, but maybe starting with the vision of what we want to see in our community, and then tracing it back to where do we advocate for too. So then it may be a 20-minute trip over to Secure Residential Treatment Facility, our Deschutes Recovery Center. Molly Wells Darling, she can sure explain to us what Sageview is all about. And as I say, whatever I'm missing, I want to go down other paths too. So that's what comes to mind when I think of, a field trip or learning more.
Okay.
So my thought is that pretty much that same, to get the right services to the right people, we have to know what those services are, and then we've got to find a way to get it to the people. Julie, I have not yet volunteered for a committee. Would there be a space for me on the committee? I do have a strong interest in what we're talking about here.
I would love to have you on the committee. So let's just plan on that.
Sign me up. Thank you.
Thank
Because
you.
I can really resonate with what I heard Tony say, and I've got a lot of energy around that. So
Perfect. Thank you.
you're welcome. Now I have a job.
And if people still want to send me their thoughts, just one liner or whatever, it still would be nice to know so I can have that for next month's meeting.
One more thought, that IDD home that was just purchased, that we could see that before, during, and after its development too, and understand what the difference is between a residential home and a kind of a 24-hour residential support facility. Because we're going to spend a lot of money upgrading that house, bathrooms, and just the finishes to make sure it's going to last a long time. Because as I say, when you have support, you have multiple people living there, it's going to cost. It's always shocking how much we're going to cost to upgrade it to a usable level. So, but it's valuable information.
Yeah.
Amber, did you have something you wanted to add? You had your hand up.
Yeah,
earlier.
sorry. I know my hand went up. My hand is yellow in the corner and it like kind of blends in with my office. I probably should change it. But anyway, I just was going to say, actually, Danielle put in a message similar to what I was thinking of, just where possible, just messaging about resources and services too, in whatever way you decide as a group to do that. I'm not in any way saying you should do this as your outreach, efforts, but, you still find people in the community not knowing where to go for services or what's available and not realizing there's a stabilization center that's 24/7. And guess what? They also serve children and young adults. So I just think too, being kind of an extension too of our services and being able to talk about that and share the resources is never a bad thing. And just continuing to talk about behavioral health concerns, mental health, substance use, IDD to reduce the stigma about it. So just that's my encouragement for this group too.
Yeah, thanks for doing this, Julie. I mean, my experience doing outreach was not very fun and not very effective. when we did it, because we went to a different booth and handed out the rack card, and it seemed disjointed. So hopefully we can give you the input you need to be more targeted, because there was a lot of excitement over the opportunity, but not as much a direction with what to do with it. And I appreciate you looking at that. And I agree, finding some sort of resource, because if you go to an agency, if a client gets into an agency, they can get a list sometimes for that sort of stuff. Where's it go? But if I need that all access point, where do I find it? That does seem like a common thread that we've been talking about for a long time. And I just really support what you're doing with this to help take what you're doing and make it more targeted. Thank you.
Thank you. Two quick things. I'm trying to make sure I don't go over time. When I came on to this board, I think it was like over 2 years ago, outreach, I think the thought was you go out to the Oregon Health Fair, you sit at a table and you hand out the rack card, which is what you're talking about. And nobody in the group seemed to want to do that or thought it was very effective. So that's why we pivoted to trying to do something more meaningful. The other thing that I had a conversation with Melinda Thomas, and she was saying how she thought it would be really neat if, as a board, we could take all the resources that we think that are out there, the main ones, and bring them all together and put them on some kind of a piece of paper so that that was something that we could hand out if we were doing outreach and say, hey, here are the resources and connections that we have within the community. And we've kind of put them into little areas. And I just was like, Melinda, are you sure that's what this committee needs to be doing? Because I think that maybe is already being done somewhere else. So there again is, what does everybody define outreach as? And it's different for everybody, but what do you all want to kind of see us doing? I love the idea of going out and I'm less educated than 75 or 90% of the people on this video call. But when I have an opportunity to go to the stabilization center or Sageview, I want to get over to the jail. That to me is how I'm going to get the most information, is by doing it in person. So I kind of like those little meetings. I like throwing them out there, and if people can make it, great. And if they can't, you know, somebody will still be there. One person, maybe two, those two people will benefit. So that's kind of the direction I'm going, unless I hear something from people otherwise. So enough, I'm done. I've talked too much today. Sorry. Lee, you have your microphone on. We lost Lee.
We sure
did.
Say he was
Looked
gonna
like
jump
it.
from his office to his car, but I thought I saw him already do that, so I'm not sure. Oh, he's coming back.
There he is. Yeah.
It dropped on me. It's okay, Julie. We're actually ahead of schedule a little bit.
Yep. I'm done.
Danielle, any updates or directions or goals with advocacy committee?
Thanks, Lee. The only thing that has happened is after our last meeting, we did put together a letter to support, and I have done a lot of testimony on different bills and funding. So, but I think this was for the funding, healthcare workforce funding. Is that right, Holly? Do you remember? Is that?
Yeah, it was 2024. Workforce funding.
So we got that done, and it sounds like Melinda submitted it. So that went in. There hasn't been anything else. If there are any other letters of support that we're thinking about putting out, like Holly or anyone, if there's something you think, I know there's, we got through the April 9th deadline of bills. Now we have another round coming up where things will get whittled down again. So probably another good time to get things in if needed.
Yeah, I'm pretty active in multiple legislative committee meetings. I'm tracking certainly the bills that we're interested in, and there's Another one that's really impactful is the inclusion of the impacts grant in the Criminal Justice Commission's budget. This is one I testified on a while ago. It's not necessarily considered a behavioral health bill. And so it's not being tracked by the Association of Oregon Community Mental Health Programs, but it's very impactful for us locally because that is the grant that funds the overnight hours of the stabilization center. We've had that grant for 4 years. It is the reason we're able to be 24/7, and it was not included in the governor's recommended budget for the Criminal Justice Commission. So I testified. It looks like it's getting some traction. There's a lot of people that are supportive of looking to include it, but it's going to be, there's going to be some decisions and probably hearings around that, or opportunities potentially for another letter on that front. I'll keep you posted. I don't know the process for something. It's not like a bill. It's like it was something that was left out of the budget, of the recommended budget. So it's like I don't know the process for which that gets advocated for, but I'm going to be following that and tracking that, and I'll let you know where you can insert yourselves if you're interested.
And if it's helpful, if it's in between meetings, I don't know how I guess we haven't set up really a protocol for that because, we go a month between meetings. And if something comes up this next round, I think is, Bill's, the next round is like May 9th. It's another like 1 month from the last one where the next level of cuts happen. So I don't know. I would think maybe Lee and Melinda and myself, maybe if an email went out to everyone, and folks could say if they agreed with doing a letter or not. But I guess this isn't something we've chatted about.
Yeah, man, that makes sense to me because these things can't always wait till the next meeting. So if Lee and Melinda are comfortable and the group's comfortable with that, if there seems to be an urgent need, I can just have Dana or myself send out a mass email asking for the request. People can either vote by email saying they're okay with it, and we can proceed in an off meeting way, or if it can wait till the meeting, we obviously will do that as well.
I'm all right with an email. I think that would be supportive, and whatever helps get this communicated well in between, because that is a thing that Melinda and I have been like, well, not sure of, and appreciate your input on Danielle's like with making these deadlines that are in between. So yeah, that could work.
Yeah. So with that, if things come through, we can decide on it and we can get letters sent in if everyone's in agreement. And then, things will quiet down after end of May, beginning of June, probably for a while. So there won't be as many of these last minute ones, and we could do more proactive stuff if we wanted. But that's all I have.
Awesome. Thank you. This is the final item being just upcoming events. Anything to add to our calendar, make anyone aware of for events with your organization or stuff out in the county between now and our next meeting?
You're muted, Lee.
Oh, I don't know if you heard me, but this is just our calendar upcoming events section. So if anyone has any events they would like us to put on everyone's radar, now is the chance to pass that along and share that with the group.
And the break.
No, go ahead.
I was just gonna, and the Breaking Barriers is coming up soon too, isn't it? Yep. So that's another big one. We have a couple in the chat, more than medical fundraising luncheon and mental health awareness month for May. All good ones.
And NAMI has their walk on May 18th. Thanks, Julie. That's in the chat as well.
This is Linda. I have a question. I don't know how do I get contact information? Like if I need to reach out to Julie about the committee conversation, is there a roster that's available? I'm looking at the emails that went out and it looks like the addresses are under VHAB as a list, but how would I reach Julie or another board member? I don't have emails or phone numbers or agencies available or if I do, I don't know how to find them.
I can send you that list, Linda, of emails.
Oh, thank you very much. I'd appreciate that.
Mhm.
Okay, well, there's nothing new added to the chat. And thank you everyone for a productive meeting. And we've got some homework to come back on for different items. But yeah, we motion meeting. I'll call the meeting adjourned with a few minutes left to go, a little early today. Thank you for your time.
Thanks, Lee. Thank you.
Bye, everyone. Thank you.
Have a great day.
Happy Easter.
Happy Easter.
Yeah.